Well, we've come to the end of the home birth course, and of course, we're going to throw in extras. Honestly, you know, if we really just kept saying to people, buy the complete course, you get all of them. But we rearrange all the modules for specific search engine terms. So people who are looking for home births are looking for home births. You're going to still get most of the skills, but you're not going to get the slant for people who are having hospital births, people having birth center births, or necessarily because you're having a breech birth, or because you're a first-time mother or father. Because this is what drives you absolutely nuts about pregnancy and childbirth, is that 100% of pregnant women will give birth, but you're all dealing with your own individual stuff, right? So we are trying to make certain that you, as home birthing families, get the skills that Birthing Better Families developed. And touch and communication were two of the powerhouse skills. They're all powerhouse skills. They're just different. So communication, touch is a form of nonverbal communication, but your body skills is different than communication, and your breathing is different than communication, but you're working together with the teamwork and blah, 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 blah. And you're working with the progression of labor, and you're working with the 5 phases of contractions, and you've done the internal work, hopefully. And so we're going to give you the touch and communication because fathers really want to help, and it's exhausting for them to keep using verbal communication. Besides which, when we're in labor, we don't want to hear it. It's distracting. And we want the right touch in the right place at the right time. So families developed the touch, and there's a PDF, and there's also a video that goes with it. So practice. And we really encourage all of you pregnant women to do the practice on their partner first, because when they understand in their body, they can help you better. It stops being a mystery. Childbirth and pregnancy and childbirth are mysterious enough. It does not have to be mystifying. We share the same body. If a guy had a big object in his belly, then we'd be doing the same thing. The exact same thing. You try to get the big object out, and the best way to get the big object out is to create more space, more mobility, more flexibility, and softness inside the container. That makes sense. The communication part of this that we're giving you is the verbal and the nonverbal communication, and it ties into the PDF on the positive and negative voice. Women are communicating with themselves all the time. Everybody does. Men do as well. But in pregnancy and in birth, we just blah, 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 blah. And in birth, can be minimized because we can't say it out loud. It's distracting often, and it's hard to articulate. But our minds are responding to the sensations we're feeling or what they're doing to us around us. So we have a verbal, nonverbal communication in our mind, and in that PDF and the other lesson, you learn how to use your skills and respect that part of your mind. But nobody knows what we're thinking. So when you see women who are very in control of labor, I'm very in control of labor, but I hate it. Every time I have a contraction, all I can think of is F, 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 F. It hurts. And I use my skills to manage myself. So when we have the communication resource, you're going to learn verbal and nonverbal communication, which will tie in to the teamwork PDF. So these are our extras to you. Are you going to have a home birth? Yeah, sure, we hope you will. Did Birthing Better Families all have home births? No, of course not. Did some of us end up in the hospital because we had a long first or second stage or we didn't cope? Yup, we did. However, all of us who are Birthing Better Families actually learned. We didn't guilt trip ourselves. We learned. I can't tell you how many of the tens and thousands of Birthing Better Families who have used the resources have come back and said to me, next time I will learn the skills more deeply and I will use them more precisely. What precise means to each woman means that she will pick and choose which of these many skills to use at any moment of time. In other words, we realize when we choose to stop using our skills, and it often falls under can't be bothered. So when we commit to using our skills and keeping that consciousness alive, we continue through that task being highly and more refined in our skills. And this is why we're giving you this lesson. And this is true of birth coaches as well. I can't tell you how many tens of thousands of men have come up and said, these birth skills were made by men for men. I understand them. My job is to see and hear how she is. I will not know what she is thinking. I can, through communication, help her help me help her. That's important. And fathers, men, husbands want to be able to participate in the birth of their baby so that they come out of the birth feeling confident as fathers and working together with their baby's mother. That's what we as men want as human beings. Do not discount this. It is important that you understand this. We are all one humanity. We all have a brain. We all thrive on being skilled. We just want the right skills for the task we have to do. And a birth coach's task is different from the woman who's doing the activity of birthing her baby. The birth coach is no less important. They need sophisticated skills to help the woman primarily cope and manage, but beforehand to have prepared her body so that you can help this big object come down through and out, so that ultimately you are preventing or reducing any risks from becoming problems. That's your tasks, both of you. So enjoy these extra lessons. Please pass on birthing better to other people. We're not well known. The concept that it's normal and natural to learn skills in pregnancy and use skills to birth your baby, no matter where, no matter what, is not the norm. We need to change it. You have to change it. You're the ones who are social media geeks. You get to spread the word of birthing better.